Good afternoon, everyone. Thank you for attending this webinar. Today we're going to be reviewing how to submit your intervention to the SNAP-Ed Toolkit. Before we get started, I'm going to share a few housekeeping items. The first is that you'll see two options for sharing questions. Today we'll be just using the Q&A function to share questions. So throughout the presentation, feel free to chat in a question through the Q&A, and we will respond to it either during the Q&A portion of the webinar, or if it's a general question, we'll respond to it in the Q&A box out to everyone. As a participant, you will not have any audio functionality, so using the Q&A box is the best way to communicate with us throughout the webinar. And lastly, we are recording this webinar and we'll be hosting it on the SNAP-Ed Toolkit website afterwards. So if you need to leave early or need to revisit any of the content, you will be able to do so online. So today we are joined by Lisa Mays with USDA Food and Nutrition Service, Justine McFarland here at UNC Center for Health Promotion and Disease Prevention, and Tracy Wesley, who is also here at the UNC Center for Health Promotion and Disease Prevention. And what we'll be reviewing today is really an overview of the SNAP-Ed Toolkit, its purpose, and how that fits into the submission process, some technical aspects of the submission process to make that, that experience easy for you, as well as some tips for how to apply the REAIM framework to your intervention throughout the submission application. And then we'll have about 15 minutes for Q&A with me. I'm Claire Sadig-Zadeh, and I also work here at UNC Center for Health Promotion and Disease Prevention. So without further ado, I'll pass it over to Lisa to give us an overview of SNAP-Ed and SNAP-Ed Toolkit.
Thank you so much for that, Claire. And if we could go to the next slide, please. So first, let's give folks a little bit of an introduction about the Supplemental Nutrition Assistance Program Education, or SNAP-Ed program. SNAP-Ed is the nutrition education component of SNAP, and the goal of the program is to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans, or DGAs. Section 28 of the Food and Nutrition Act of 2008, as amended, states that SNAP-Ed programs must use must use interventions that are evidence-based for use with low-income individuals and communities, and use multiple strategies, including individual and group-based nutrition education, what we typically refer to as direct education, as well as comprehensive multi-level interventions at multiple complementary organizational and institutional levels, as well as community and public health approaches. This is a longer way of saying policy systems and environmental change interventions, as well as social marketing interventions, or interventions that use a combination of more than one of these approaches. Next slide, please. To help our state and local agencies find these evidence-based interventions, there was a joint effort between the USDA Food and Nutrition Service and the National Institute of Food and Agriculture, or NIFA, as well as many academic and research organizations across the country to develop the SNAP-Ed Toolkit, which is currently continued and maintained through a joint effort with the Food and Nutrition Service and the University of North Carolina at Chapel Hill. The SNAP-Ed Toolkit contains the interactive SNAP-Ed evaluation framework to assist states and local agencies with their evaluation efforts using 51 behaviorally focused outcome indicators and associated data collection tools. It also contains training resources to assist with evaluation and implementation and development of nutrition interventions. And it also contains the searchable database of SNAP-Ed interventions that are peer-reviewed, evidence-based, use multiple approaches, and are appropriate for diverse settings and audiences. Next slide, please. In order to best expand the selection of interventions that are available to state and local agencies, we developed the SNAP-Ed Toolkit Intervention Review. Currently, we have 134 interventions that are available to choose from. Our last intervention review in fiscal year 2019 added 52 new interventions for implementing agencies and state agencies to explore. This is a great expansion of interventions that allows us to increase the selection of interventions that fit state and local specific SNAP-Ed needs, increase innovation by encouraging adoption of new interventions which reflect the most up-to-date research, and we also worked along with representatives from other agencies such as CDC, and again, a number of institutions, research and academic institutions across the country, to improve the transparency of the review process and the criteria for inclusion. Next slide, please. So now here we are at our fiscal year 2020 intervention review, and we just want to help you keep in mind some important dates for intervention submission. Of course, on December 2nd, the online submission form opened and became available for submissions. And please remember that on February 28th, that online submission form will close and we'll have to cease accepting new interventions for the time being. The review period will begin after that, and May 22nd, intervention decisions, whether an intervention is included in the toolkit or perhaps there's some suggestions for additional evaluation or adjustments that could be made. Intervention developers will be notified by May 22nd. And then throughout summer 2020, before the start of the next fiscal year, the interventions that have been chosen to be included in the toolkit will be integrated into the SNAP-Ed toolkit in the similar format as the ones that you can find available now, with lots of descriptive information and information about appropriate evaluation indicators. Thank you.
Okay, I will be doing an overview of the intervention submission process. During this call for intervention, we'll be using an online submission portal for people to submit their applications. This process will help you make sure that you submit all the required information and hopefully streamline the process moving forward. I'm going to quickly go over and review some of the best practices and tips that we have identified. And if you have any other questions, feel free to chat them into the Q&A box for us to discuss later. Okay, getting started. The first thing you're going to do, or something that you may have already done, is express interest in submitting your intervention. If you're getting started, you can do this by going to the SNAP-Ed Toolkit website and visiting the Submit an Intervention page. At the bottom of this page, you will find a form that looks like this, and you can complete it with your first name, last name, and email address. After completing this form, you'll be sent an email with your own unique link to submit an intervention. If you're submitting more than one intervention, it's important to submit more than one of these request forms, just so that you can get multiple links in order to submit multiple interventions. So this is the email that you will receive after you've submitted your interest form. Your unique link is highlighted at the bottom of the email, and this will take you straight to your application. You'll be able to start your application, pause working, and restart the application using this link in the email. So make sure that you always access through that unique link. Also, please note, as previously said, that you have until the end of February to submit your intervention. The online submission forms follow the same format as the PDF submission forms that you may have already seen. All we did was convert this PDF into a Qualtrics survey format. So for the most part, everything looks the same. There are, however, some differences that we'd like to point out. Questions 14 and questions 18 are going to be split into several questions in the online submission form. However, the questions and responses are all in the same order, so nothing should look too surprising or different from the PDF. Then a little bit more on general format. You will have a progress bar at the top of your page, and as you complete a section, the progress bar will move forward towards 100%. At the bottom of each page, there are also going to be navigation arrows. to help you move forward or go backwards from question to question. Please note that you'll only be able to advance once you've completed all the required questions on each page. Some of the questions have a character limit, and this will be shown to you by after the question or the prompt, and you'll see how many characters are allowed. Character limits do include spaces, as well as when you press enter to go to a new line. So just take that into account when you're entering text into the box. The online submission form will provide a count of remaining characters as you enter your text. If you dropped your application in a PDF or Word and are copying and pasting your text into this box, please make sure that all the text fits into the box and that nothing gets cut out when you paste it in. Some of the questions are required, and both the PDF form that you may have seen and the online submission form use asterisks to denote which questions require a response. If you don't fill in one of those questions, you won't be able to move forward, and you will be shown this notice message asking you to please fill it in, and the question required to be filled in will be highlighted in blue. Next are a few tips for attaching your documents. The documents that you want to attach cannot exceed 100 megabytes. So please also pay attention to the length of your file names and try and keep them as short as possible. To select a file, you can either drag and drop a file from your computer onto this gray block, or just simply click anywhere on the gray block and it will take you to your file saved on your computer. So when you click on that gray block, it will take you to your desktop where all your files are saved, and you can just select a file that you want to upload. If you want to change the order, you'd need to replace a file that you uploaded, because you cannot change the order by just dragging and moving files once they're already uploaded. Okay, I'm going to hand it over to Tracy, and she'll be doing the REAIM framework information for you.
Thanks, Justine. Good afternoon, everyone. I'm going to spend some time this afternoon talking through the application of REAIM to your intervention. And we're doing this because the REAIM framework will be used to facilitate the review of interventions for the toolkit. So before we get into the specifics on REAIM, I wanted to just touch on a couple broader topics as they relate to the intervention submission process. First, we want to suggest that as you move through the submission process, that you work to ensure that your submission form and attachments include important details on how you developed the intervention, how it was tailored to the intended audience, as well as how its success was evaluated. I also wanted to mention briefly how the toolkit includes interventions that are categorized based on the 3 evidence-based approaches that are described here. And this classification is based in part on how rigorously the intervention was evaluated. So with emerging interventions, they include evidence-based approaches, but the intervention hasn't yet been formally evaluated. Practice-tested interventions include an approach that is based on published or unpublished evaluation reports, or case studies that show positive effects on individual behaviors or PSE change. And then research-tested interventions are the most rigorous in terms of their evaluation, with significant effects on individual behaviors or PSE change that are described in peer-reviewed manuscripts or evaluation reports. And more information on these classifications is provided in the link shown here. And interventions based on any one of these approaches are encouraged for submission in the toolkit. So we wanted to first check in just to see how familiar you are with REAIM. So please select the answer choice shown here that best reflects your understanding of REAIM. Great, thank you. And just a heads up for those who are maybe less familiar with REAIM, we have some references, that we'll share at the end that may be useful for you to kind of build some of your knowledge base. Sorry about that. All right, so I want to first provide a brief overview of how we'll move through the rest of this webinar. And if you've had a chance to look through the submission form, you'll notice that it's structured around the re-aim dimensions. And we're going to follow this same structure as we cover the 5 dimensions. So to help you get a better sense of what is needed as you work to answer the various questions in the submission form, we're going to use some examples from past submissions for interventions that are currently included in the toolkit. So for each dimension of re-aim, we're going to first provide you with some background information on the example intervention, so you'll have a sense of what the intervention is about. And next, we'll take a look at some questions that will be important for you to address as you complete the submission form that relate to the specific re-aim dimension. And then we'll show some answers from the example intervention submission form that show how the intervention successfully addressed these questions. So we're first going to look at the reach dimension of re-aim, and the example intervention that we'll use is food share. And this is a PSE change intervention that was developed by the University of South Carolina School of Medicine and Arnold School of Public Health. And it's classified as an emerging intervention in the toolkit. And food share aims to improve food security and health through fresh food access and affordability. And this is done through the distribution of a fresh food box every 2 weeks. That includes 12 to 14 types of fruits and vegetables, along with a recipe card. So when working on the reach section of your submission form, these questions can help you make sure that you have complete answers. They can serve as a check to make sure you've included important details, such as identifying and addressing barriers or how well your intervention reached your target population. So we'll take a look at the response from Food Share's intervention to see how they addressed some aspects of reach that are important to cover for their review. So shown here is their response to question 19 on the submission form, which asks you to describe how your intervention reaches the intended population or SNAP-Ed audience segment. And while I know this slide is very text heavy, just bear with me as we work to highlight different pieces of this response in the following slides. For example, one of the questions I just mentioned that is important to address for reach is if potential barriers were identified and addressed. So here I've highlighted section of Food Share's answer to question 19 that identify how cost as well as accessibility are barriers to making healthy choices. The intervention addressed these cost, accessibility, and transportation barriers by setting up a network of partner sites and neighborhood coordinators who both take orders and distribute the fresh food boxes directly to participants in the community. We can next look at another question important to address in the reach section, which is to describe what was done when developing the intervention to make sure it was appropriate for the target population. And here again is Food Share's response to question 19, and we can see that the program supports Hispanic, Latina, and African American families. And these families each have food preferences based on personal experience and cultural significance. And the intervention developers mention here how they held focus groups with the 2 groups that helped them to develop specific produce lists for the different boxes, which is a nice example of how the intervention worked to make sure it was appropriate for the target population. And lastly, with reach, it'll be important to explain how those reached by the intervention are representative of the target population, as well as if those reached by the intervention were most at risk. And we can see here that the Food Share intervention included a screening and referral process with clinics that allowed them to reach more participants, and likely ones who were most at risk. And this is a somewhat unique example in that we're able to answer a fair amount about reach in a single answer, but this isn't necessarily going to be the case as we move through the other dimensions. With some of the other dimensions, you'll see that we'll only be able to highlight one or two aspects of the dimension important for the intervention review using some of these examples. And this is going to be more evident as we look next at effectiveness. So for the effectiveness dimension, the example intervention we'll use is match. And this is a PSE change in direct education intervention that was developed by Match Wellness Incorporated. And it's classified as a research-tested intervention in the toolkit. And Match is designed to decrease BMI and increase healthy eating and physical activity among 7th graders through a teacher-developed approach that integrates physical activity, nutrition, and technology education. Before we get into the specifics of the effectiveness questions, we do want to encourage you to become familiar with and use the SNAP-Ed evaluation framework. There's an interactive version of it that can be found at the website shown here, and we'll provide some more specifics around its use in the submission form in the slides to follow. So the effectiveness section of the submission form is the most extensive in terms of questions and content to share about your intervention. So it will be important here to include enough detail to help the reviewer understand aspects of effectiveness, such as how intended outcomes were achieved and how the evaluation was conducted. And including relevant attachments that support these pieces is strongly recommended. You'll want to work to give the reviewers all the evidence needed for them to look at the impact of your intervention on the intended outcomes. And here we can see Match's response to question 22, which asks what intended outcomes were achieved and to what extent. And the intervention developers have selected specific outcome indicators from the SNAP-Ed evaluation framework. For example, outcome 1 looks at the indicator R9, or healthy weight, and more specifically at R9B, or the percent of SNAP-eligible persons at healthy weight. And in the extent achieved cell, we can see that post-intervention, 61% of overweight participants decreased their weight status, and the corresponding numbers for this percentage are also included. And this information provides the reviewer with detailed evidence showing how intended outcomes were achieved. In this case, the intervention was able to tie their outcomes closely to the SNAP-Ed indicators, but this may not always be the case. There may be instances where it's either not feasible or difficult to complete the numerator and denominator fields. So just do the best you can in terms of how best your intended outcomes align with the SNAP-Ed indicators and to complete the fields. It may not be the perfect fit, but working to include some information in these fields is recommended. And it's also important in this section to make sure that your attachments provide useful supporting details so that you're able to give the reviewer a clear understanding of how your intervention outcomes were measured and achieved. And here we can also look at another question in the effectiveness section on the submission form, which asks about unintended or unexpected outcomes that occurred and to what extent. And again, the text here is information that was included in the match submission form. And we can see here that the developers did a nice job of clearly specifying unintended outcomes of the intervention. They mention unintended benefits as well as challenges, and then make some recommendations. So this allows the reviewer to better understand some unintended outcomes, as well as describing some challenges and recommendations that become important lessons learned for future users of the intervention. So before getting into the next re-aim dimension, we just wanted to pause to check to see how helpful the example was in addressing effectiveness, particularly in question 22, and we just wanted to see if it would be helpful to see additional examples of question 22, perhaps from other interventions in the toolkit that may be practice tested or emerging. Great. We will definitely work on passing along some more examples. So next we'll take a look at the adoption dimension of REAIM. And the example intervention that we'll use is Eat Smart to Play Hard. And this intervention was developed by the University of New Mexico Prevention Research Center. And it's a social marketing and PSE change intervention that's classified in the toolkit as practice tested. And the campaign engages students, parents, teachers, and staff, as well as other stakeholders, to eat smart in order to play hard. For the adoption section of the submission form, these questions can help make sure that you've covered important aspects of adoption. Answering them can help give reviewers more detailed information on the settings or partners involved in your intervention, how these settings or partners were engaged, and how they effectively reached the SNAP-Ed target audience. So here we can take a look at Eat Smart to Play Hard's response to question 30 in the submission form, which asks for a description of how the partners or settings selected contributed to the success of the intervention. In Eat Smart to Play Hard's response to this question, we can see information on how partners were engaged and what resources were required for adoption. The highlighted text shown here shows how the intervention was developed in a way that requires minimal work from school staff, encourages families to volunteer, and provides support for direct education by other implementing agencies. So we can get a good sense here about how and what types of partners were engaged and some sense of the resources required for adoption. We can also look at this same response to show evidence of how the settings or partners can reach the SNAP-Ed target audience. So in the first sentence here, we can see that schools receiving over 50% free and reduced lunch were targeted as a simple method to reach the SNAP-Ed audience. Additionally, the developers mention how collaboration with other implementing agencies has helped them expand the reach of Eat Smart to Play Hard to a great number of schools. Next, we'll take a look at the implementation dimension of REAIM, and the example intervention we'll use is Fresh Conversations. And this intervention was developed by Iowa Department of Public Health, and it's a direct education intervention and is classified in the toolkit as research tested. And the intervention supports healthy aging and independence through a nutrition education program that includes monthly interactive sessions and newsletters. And for the implementation section of the submission form, descriptive information with sufficient detail is key. You'll want to make sure that the implementation instructions and materials are clear and easy to follow, and supporting materials that provide additional details, as well as evidence that the intervention was implemented with fidelity, are also important to include. And you can use these questions to help you check that you've included all the necessary information for their review. So here we show Fresh Conversations' response to question 34 on the submission form, which asks for a description of the main components or critical features of the intervention's intent and design that should be kept intact when the intervention is implemented. So as we take a closer look at the main intervention components and see if they are described clearly and with sufficient detail, we can first see that this example does a nice job of referencing documents that are attachments to the submission form that provide additional details. We can see here how the developers reference an attached logic model, as well as a program description in a journal article. And they also have an unpublished web page that contains newsletters and guides from the intervention. So with this initial information, the reviewer has a sense of where to go for important details on the intervention. Additionally, the developers do a nice job of highlighting in their response the main intervention components. We can see here how they describe the newsletter and facilitation guide as core materials, mention how the guide has optional activities, and also that food tasting or sampling and goal setting are essential activities. The developers also specify how physical activity demonstrations are recommended at each meeting and how interactive facilitation is essential to program success. So in the response, the developers have not only worked to summarize the required activities or main components of the intervention, but also have directed the reviewer to additional documents, to more information to give a more comprehensive picture of these components. So maintenance is the final re-aim dimension, and we'll use the cooking as a SNAP intervention as our example intervention. And this was developed by the University of Minnesota Extension and is a direct education intervention. It's classified as a practice-tested intervention in the toolkit, and it's an in-person culinary nutrition education course where participants practice food preparation skills to make cooking and eating at home easier and more rewarding. And for the maintenance section of the submission form, information on a range of factors influencing the maintenance of the intervention should be addressed. Some of these factors include describing modifications to the intervention, as well as showing consistent support from involved organizations. You'll also want to include evidence showing maintenance of the outcomes, if available. And the questions listed here, along with your review of the intervention scoring tool, can help to ensure that you've included all the needed information for your intervention review. So here we've joined the responses to questions 40 and 41 from the Cooking as a SNAP submission form, which ask about the adaptations or modifications that were made to the intervention over time and what effect, if any, have these modifications had on the intervention. So let's take a closer look here at how modifications to Cooking as a SNAP have been described. We can see here how surveys are completed by participants after each session, and also how nutrition educators provide ongoing feedback on course content, methods, flow, and participant experience. And there's also a mention of how a grant-enabled an effectiveness comparison study of Cooking as a SNAP in more rural settings, how the curriculum was tested for clinic referral, and how modifications were made based on the 2015 dietary guidelines and 2018 physical activity guidelines. And while not shown here, some of the attachments for this intervention provided additional details on some things mentioned here, like the clinic referral program. Additionally, the developers also explained in the final sentence how different aspects of the intervention, such as participant and nutrition educator experience, have improved as a consequence of the revisions or modifications made to the intervention. So before wrapping things up and shifting into the Q&A, we wanted to pause here to see if there's a particular re-aim dimension or more than one dimension that's still not clear. Please do answer open and honestly, and we can provide some additional support just to make sure everyone has a good understanding of the dimensions. Great, thank you. And then we would like to just ask one more polling question, which we are curious to know how many interventions do you plan to submit for peer review? So these are the additional resources that I mentioned earlier. We have the trainings from last year, the developer, as well as the reviewer webinars. There are a few different resources that are on REAIM, and then the SNAP-Ed evaluation framework that I'd mentioned earlier as well. And definitely reach out to us at the email address here if you have particular questions. Thanks.
Okay, thank you so much, Tracy. We hope these examples were helpful for just thinking about how you would translate the great interventions that you've developed into this submission format. So we have about 25 minutes, and we'd love to have any questions that you have either about the process, REAIM, or if you have any intervention-specific questions, we'd be happy to try our best to answer them. So feel free to add them to the Q&A box. Or I can also, I see Lori has raised her hand, so I will, Lori, I'm going to unmute you for a second just to ask your question. So, hi Lori, do you hear me? I think you're muted.
Can you hear me?
Yes. Hello.
Hi. My question was, if an intervention that we submit is accepted, how is it distributed? Is it just included in the network, or are there any procedures used where new activities are kind of featured or highlighted either at conferences or through webinars or other events? Thank you.
Well, I can share a few things on our end, and then Lisa and other folks can feel free to chime in. So primarily, we work to get the intervention description listed on the SNAP-Ed Toolkit, and we did some promotions around new interventions added through listservs like ASNA and SNEB. I know this year at ASNA, this was kind of a coordinated effort beyond us, but this year at ASNA, they're having poster presentations with accepted interventions from last year. So I think there's kind of, we do some promotion on our end around just kind of making sure people know what's new to the website when we add it, but there have been some other kind of additional things and activities around that. Lisa or Tracy, Molly, do you have anything else to add to that?
This is Lisa, and I'll go ahead and add, at FNS, we don't necessarily say, hey, these are lots of new interventions. I know that they are newly added interventions are marked as far as being one that is new, and that has been done, for instance, for the most recently added interventions. That said, we do know here that a number of states actually recommend that their implementing agencies choose interventions from the SNAP-Ed Toolkit, and the developers have done such a fantastic job of making it really, really easy to search and drill down to the exact one that works for your needs, that we found that people are really starting to adopt those toolkit interventions. You, of course, if yours is chosen to be included, are also welcome to mention in your promotion materials that it is included in the SNAP-Ed Toolkit, which is a way of letting folks know that it is appropriate, again, for use with a low-income audience or community.
Thank you.
Thanks, Lori. I'm going to mute you again, but thank you for that question. We have another question that I'll just kind of pose to Tracy and Lisa and the folks in the room. This is from Sue Singh. She asked, do we have to have individual behavior changes for practice-tested PSE intervention for effectiveness? If we only have food or physical activity environments data, such as number of sites, and activities we did related to the PSE, would that be sufficient?
This is Tracy. That's a lot in a question. Sorry to make sense of it. If Lisa, I will let you weigh in first, but it may be something that would be worth kind of email communication about to talk through. Unless Lisa, you have some initial thoughts or others.
I would say that when looking at if something is evidence-based, it doesn't necessarily have to go to individual behavior change. There are things like, the nutrition supports adopted, but it does sound like you may have some specific questions that would be best answered by Tracy and Claire and the Toolkit team. So Susing, I agree with Tracy that this is a great thing to email them about.
Yeah, I would be happy to kind of be in touch with you afterwards about this, since it is a little bit more specific of a question, and then through some back and forth, hopefully we can help you to get your answer.
Great. Okay. The next question is from Rebecca. If an impact evaluation has recently been conducted, including a comparison group showing significant behavior outcomes, but has not yet been submitted to a peer-reviewed journal, should this intervention be submitted as research or practice tested?
This is Tracy, so I can answer that initially, and then Lisa, feel free to weigh in. So in the intervention submission form, there is a link to a checklist of sorts that talks you through how you should classify your intervention. My sense is that this will likely end up as a practice tested one, just based on the information shown here. But I do encourage you, I'm not sure I can look up what specific question it is in the submission form, but that would provide you some guidance in terms of walking through to try to identify that. But yeah, again, I think I'm leaning towards practice tested, but Lisa, anything more to add?
I think you've said it best. Thank you.
Yeah. Great. Thank you. And I'll just share, we have had folks have journal articles under review and then send them to us later, and then we're able to adjust the evidence-based classification. So yeah. And we're currently in an intervention update phase as well. So right now we're having folks who have interventions included in the intervention or in the toolkit. They're able to submit new effectiveness data or journal articles or publications to support moving up the evidence-based classification spectrum. So it's definitely not like it's not static. You're not at the same one forever, especially if you're doing more testing and dissemination of that work.
And one more quick thing to add with that, if a manuscript preparation is in the work, then if you have, if it has been submitted or and it just hasn't been reviewed yet, it would be helpful to just indicate that on the submission form, just one, so that the reviewers know this, and then it will, can help us in terms of, if that changes over the course of the review process, we can update the reviewers.
Great, thank you, Tracy. Are there other questions that folks have? Feel free to raise your hand or chat it into the Q&A box. Okay. Well, if we don't have other questions, I'd just like to highlight our email here on this slide. It's snapedtoolkit@unc.edu. We are always more than happy to answer any question about the process, and we'd also be happy to help you think through the smaller details around how to take your intervention and translate it into the form. So feel free to reach out to us whenever you have questions or thoughts. Just a reminder that the submission period will end at the end of February. So hopefully that gives you plenty of time. Yeah, and we really appreciate you joining us. I hope these examples were helpful for you. And thank you so much for your time this afternoon. And thank you, Lisa and Tracy and Justine, for sharing that great information with us. Okay, well, Thank you so much and have a great afternoon.